This is another one in our series of webinars called Ideas from the Field. Today we're going to be talking about reopening strategies with some folks from Seeds of Literacy. And just a little bit about our Ideas from the Field webinar. They feature folks out in the field doing the work who've agreed to come and kind of share a little bit about what they're doing. So far, we focused a lot on distance learning. We're opening up those a little bit to talk about some of the issues that folks might be dealing with in terms of reopening their literacy programs, maybe doing some blended learning. We've got some workshops like that coming up. And as we go along, we're going to kind of continue to open those up. If things ever get back to normal, we will, kind of shift and start to focus on management strategies and teaching strategies and things like that. We are recording, so you will get a follow-up email on Monday. That email will have a link to the webinar recording. It'll have the PowerPoint slides that the folks from Seeds of Literacy are using today. They've agreed to share their PowerPoint. We'll have this is something we started doing new. We'll have a one-page information sheet that kind of summarizes the key points from the webinar and has a list of resources. And so that's a nice piece that if you want to share some information with your coworkers or colleagues, it's an easy way to do that. And then we'll also include the chat transcript, the transcript from the Q&A, and a certificate for those of you attending. We're going to ask that you use the chat feature to introduce yourselves, which you're already doing. Let us know about any technical issues. It's a place where if Bonnie and Carmen mention any resources, Patty's my coworker, we'll go and search for those links and post them in the chat room. So we'll ask that you use the chat room for things like that. We're going to ask that if you have questions for the folks today, that you use the Q&A functionality to ask those questions. That helps us track which questions have been asked and answered so that we can make sure that everyone gets their questions answered before the end of the webinar. Bonnie and Carmen have agreed to kind of stick around past the end of the webinar, past the top of the hour, to make sure that everybody's questions get answered. So as we get close to the top of the hour, we'll kind of have a little pause. We will kind of thank you all for coming. We'll stop receiving questions at that point, but if you guys want to stick around and listen to their answers to the remaining questions, you're welcome to do that. Just a little bit about our webinar schedule. So ProLiteracy, we are trying to offer at least one webinar a week to folks. We learned during the pandemic that this is a good way to reach folks, and so we're trying to take advantage of that. So if you go to proliteracy.org/webinars, you'll see a calendar. It has our webinar schedule, so you'll see the general webinars that we are offering, including the ones from this Ideas from the Field series. You'll see webinars from New Readers Press. You'll see webinars from our membership department, and you'll also see webinars that we're presenting in partnership with other agencies. So we try to keep the registration for those webinars about 2 weeks out, but the schedule, I think we've got things scheduled all the way into January. So it's a good place to kind of see what's coming up. It's also a good place to go and get links to previous webinars we've done. Okay, having said all that, today's presenters are Bonnie Entler, who's the president and CEO of Seeds of Literacy, and Dr. Carmine Stewart, who's the vice president of programming for Seeds of Literacy. And they're going to talk about They're going to start off talking about what their program looked like kind of pre-COVID. They're going to go into the adjustments that they made during the pandemic, and then they're going to talk about how they've approached the reopening process, the safety measures they've taken, the communication measures they've taken to make sure that uh, tutors and teachers and students all know what's going on or well informed. So having said that, I'm going to stop sharing my screen and turn things over to Bonnie and Carmen.
Good afternoon, everyone. I greatly appreciate you jumping on this afternoon to learn a little bit more about Seeds of Literacy and what we have actually been doing the last 7+ months. So we're going to spend a little time on who Seeds was before COVID, our response during the COVID time, where we are in our reopening, all the things that we're doing to keep everybody safe, and how we had to change instructions to continue to be able to fulfill our mission and provide instructions to our students. So before COVID, Seeds of Literacy is actually in Cleveland, Ohio. We are in the northeastern part of Ohio, so we're right by Lake Erie. We are still, I say, a fairly young organization. We're 23 years old. We were originally founded by the Sisters of St. Joseph and became our own nonprofit in 2005. We actually also earned our national accreditation through pro-literacy at that time. And we've grown in leaps and bounds over the years. The need in our community is enormous. So unfortunately here in the city of Cleveland, we have a 66% functional illiteracy rate. So that doesn't mean that someone doesn't really have the ability to read. Someone struggles with some everyday tasks, from reading a utility bill to bus schedules to understanding doctor's instructions, everyday tasks that most of us actually take for granted.
Can I interrupt? We've had a few people say that the sound's a little muffled. Can you speak up a little bit so we can people can hear a little bit better?
Sure, happy to. Sorry, we were trying to maintain our social distance. So Carmen and I are actually in the same office right now trying to get through this. Is that a little bit better?
That's better,
okay,
definitely.
Great. Thanks, sorry. Here at Seeds, I just wanted to share a little bit about kind of who our students are. I'm sure they're very similar to some of your students. About 47% of our students are single parents. Our age bracket's a little bit higher than most people think of an adult learner. So most of our students are the 26 to 44, probably closer to the higher and the late 30s. The majority of our students, about 75% of our students, don't pass digital literacy skills. We North Star to measure that. And 88% of our students are at or below the poverty level.
So given that when the pandemic hit and we were told by our governor that we had to close our location, we had those statistics that Bonnie just shared with you in mind. So we knew that digital literacy was going to be a problem for a lot of our students. We knew that having access to technology would be a problem for a lot of our students. And we knew that having internet access was going to be a barrier as well. So our response was to close our classroom, but to try to come up with some alternative methods that would allow our students to continue receiving services. So we were actually closed for 9 days. And in that time period, we were just over communicating with our tutors and over communicating with our students so that they would be aware of, just letting them know for public health reasons what was happening, but also letting them know that we were still here for them and that we still plan to provide services. Of course, we had no idea that we'd still be doing that this late in the game. We thought it was just for like a month. So we sent out emails and we kind of multiplied our emails to our students. So instead of getting a newsletter every once a month, they were getting it every 2 weeks, so we could just continue providing them with program updates. And we also provide them with information to community resources because we knew that they would be the hardest hit and they would be the ones to feel the effects of the pandemic and the economic fallout more than anyone. We still maintain relationships. Our volunteers wrote 400 encouragement cards to our students. Our staff calls our 600 students, our 600 active students every single week. We took our phones home when we had to, once we had the order to work remotely, we took our phones home and we were calling students around the clock. We still provide service and contact from 8 o'clock in the morning until 8 o'clock in the evening, Monday through Thursday. And then we were also sending messages to our students via text. And we even included some video messages that featured our staff. I won't play this particular video because we're going to show another one later. But we just wanted them to have, or actually I'll click it for just 1 second. We wanted them to have just a little feel of that same connection that they have with their site coordinators. So our site coordinators did a really quick video so that they could see their faces and hear their voices, unlike they were used to doing on a daily basis before COVID. We also did a couple of other things. We had days where students could, so initially we asked students to come in that Monday. So we closed on March 13th. And we sent a split text message to all of our students to say, please come pick up work. We'd like for you to continue working. And so we'd given them about enough to get them through about 3 or 4 weeks. And then we realized that we weren't going to be reopening quite so fast. So we had packet pickup days where they could come in and pick up work and still allow us to maintain that social distance and to just real practice the safe behaviors that we knew we would have to continue. So we just started reinforcing what we needed to do to stay safe early. We also, when we were first talking about the fact that the technology, the lack of access to computers, lack of access to tablets was going to be a problem, our president and CEO, Bonnie, was kind of beating the bushes and reaching out to all of her contacts. And she was actually able to get 35 computers donated to us, 35 laptops computers donated to us. And also we were able to get a grant from the St. Luke's Foundation that allowed us to replace the desktop computers in our lab. Our technology providers, advanced IT pros, were able to clean all of those machines off and get them ready, load the desktops with some of the icons that the students would need, the links that they would need to access our classes and other resources. And then we delivered those computers to a lot of our students so that they could, some of them came to pick them up and we would do little classes so they would learn how to access our online learning. And so we were able to give computers to 50 different students. And we're always looking for donations, so that we can make more of them available. And we've gotten another small donation that our IT staff is working with getting prepared for our students so we can loan them out to more students. So our response initially was to do tele-tutoring because we knew that all of our students had phones. And honestly, we knew that half of our tutor force is over 60 and that technology was a barrier for some of them as well. So we thought that the tele-tutoring would be a good way and a quick way to get students and tutors connected. We didn't have to do a lot of professional development around tele-tutoring. We did digitize our entire curriculum so that our tutors are able to use their SharePoint link to access any of the materials. So if a student calls and says, hey, I'm working on fractions and I'm using a Kaplan packet, the tutors are able to pull that up and so they can see exactly what the students are seeing. So we rolled out the tele-tutoring first, and then as that was rolling out, we were doing professional development around video tutoring. At the time, we were using GoToMeeting, and we decided that it would be helpful to have live video tutoring so that our students could have that connection that they were used to. But then we also decided to ask our volunteers if they would be willing to do some live video lessons. And they responded. I mean, they scheduled and they prepared PowerPoint presentations and they did live lessons every single week, and they kept us surprised of any schedule changes that they had. And then they gave us permission to record those lessons so that we could house them on our website. And so the students had several different options for how to access. And again, we did not shorten our days. We continue to provide the same 12 class sessions. We typically offer tutoring from 9 to 11, 1 to 3, and 6 to 8, 4 days a week, Monday through Thursday.
Also at this time, we also continue to do orientation. So Carmen expanded her role, and actually we were able to enroll new students into our program all during this time.
Yeah, so our numbers actually haven't changed a whole lot, but the students that we are seeing has changed a little bit, because we're seeing students who are a little bit higher performing, and that's probably because they're the ones who have access to technology and have the comfort to pursue virtual learning. We are still getting some students who are on the lower end. We serve every student, so they, like, even from the beginning, readers will accept everyone, and we serve everyone. Our tutors have been trained to help even the lowest level learners. So then once we kind of, we went into kind of panic mode, crisis mode, really, in the beginning, just trying to make sure that our students stay connected, to make sure they have the information to stay safe, and to make sure that our tutors were still connected, because that interaction is really important. And so we had some time to kind of reflect on how that was working. And one of the things that we realized is that we were still connecting students and tutors, but the thing that was really missing, and one of the things that makes our program, I think, a little bit more unique, is that we have site coordinators in every class session. And the site coordinators are really the glue of our program. So in our physical classroom, when a student comes in, they're going to be greeted, or when the tutor comes in, they're going to be greeted by one of our staff members. And those staff members know the tutor's strengths and the tutor's likes, and they know the student's needs and the student's strengths and weaknesses, and they are able to match a student with the tutor. And with us using GoToMeeting, we didn't really have the ability to maintain that. So we switched to Zoom. We rolled that out in October. And so it made it so much easier. We could use one link for every single class session, no matter what subject area you were teaching or wanting to learn. When people come into the Zoom classroom, they're greeted by our site coordinator the same way that all of you were greeted by Todd when you came in. The site coordinators talk to the students and the tutors, and it just really is so much closer to what we had in our actual classroom. And I think that the tutors really, really appreciate that. And so what happens is, because we do focus on that one-to-one model of instruction, the site coordinators pair the tutors with a student, and then they send them into a private Zoom room. When you're in the private Zoom room, you have the option to ask for help if you need it, and then the staff members can come in and provide any assistance. Or you can leave the Zoom room and go back into the larger room and then come back into your Zoom room. And it's worked out really, really well. The students initially, they're like, oh, they come in and they're like, oh, there are all these people. And then we go, okay, so we're going to send you to your private room with your tutor. And they just have that moment. It's back to that same feeling of being in the classroom and having someone there. So the next hurdle is going to be getting everyone used to coming back. And so our communications director provided a quick video to show you all of the things that we're doing to really try to keep our students and our staff and our volunteers safe. So we are screening everyone before they come into the building. Masks are required for everyone, and we're really trying to educate people that they have to be over their noses. We've got signage and directional arrows to make sure that people know how to be spaced safely in the classroom and in the elevator. We've got air filters, a couple of them in every classroom, so that it's cleaning those droplets out of the air. We disinfect and clean everything, the computers, the tables, between every single class session. We've got plexiglass dividers that are on every single table, along with hand sanitizer on every table. And I think the most fun is that toy you just saw. It's an electrostatic sprayer that sprays disinfectant throughout the entire classroom and all the surfaces. So we are really, really doing everything that we can to keep everyone safe. And Bonnie has been stocking supplies for months and stockpiling them so that we all are able to, keep that supply that the CDC recommends, that supply of 3 months worth of materials.
So, as you can see, there's additional barriers and stuff that we've added to the classroom. One thing that's really unique about us is also not only the individualized instruction, but everybody is working at a round table, so everybody is paired together. So we wanted to make sure that all those barriers were there, so that they can still have that personalization that we really wanted to do as we continue to move forward.
This one.
Sorry.
Oh, wait a second. Okay,
There we go. Just some additional things that we're really kind of working on. So we also kind of really stripped our classroom of any potential paper that was really there. So you see our empty bulletin boards, but we did leave tissues, hand sanitizers, and there is a pencil box in the middle that we put minimum amount of pencils and pens out every time, but they are sanitized all the time, just to prevent as many touch spaces as possible. So we have technically three locations now, but we do screen everybody as they walk into the building. We take everybody's temperature. We do ask them to sign in, provide their name, their contact information from an email to a phone number, just in case there is that infection, that we have that contact tracing in place so we know who was in the building at what time, and so that we can distribute that information out to anybody if needed. Ohio is a mandated mask wearing place, so we do have masks available for anybody who walks into our buildings that does not have them available, as well as gloves if that makes someone feel more comfortable. So back in March, when this kind of really went into full effect, as Carmen mentioned, we really kind of anticipated that this would be a 3-week process. We were very fortunate. We had a phone system that everybody was able to take home. We were able to work with remotely. We were able to access all our information on drives, everything like that. And everybody had printers and anything that they needed in place. I tried to make sure they had that at their house. But I really saw that the staff really was working crazy hours, so we really needed to figure out how we can try to come back with this new normal. So end of June, I actually brought all the staff back. So we continued to do our virtual classroom from our offices, and just kind of gave that staff the time to really kind of purge our classrooms as much as we could. Get, all the tables relocated a little bit, space, distance, everything like that. But it also allowed us time to see in our own little bubble if we were able to stay safe and healthy. So initially we had planned to hopefully bring students in back in July. Our numbers in July drastically increased here in Ohio. So that kind of got put back a little bit. But we've been able to bring in random volunteers during July through end of September, just to see how implementing new people into our little environment works. So everybody's been great about wearing masks and social distancing and hand washing. We are currently in our phase 2 of our reopening. With that, as many of you, no one really has a lot of data right now. So, and most people's, I'm assuming, fiscal years have also switched over. So we knew we needed to update our students' paperwork, as well as get new TABE assessments, things like that. So we started at the end of September. We are doing kind of a couple days at each of our locations. And we've scheduled 4 block sessions where students are completely scheduled to come in. And we are giving TABE assessments as well as updating their paperwork. Originally, we thought it would be a month. We are just wrapping up our 3rd week of doing this. a little bit slower process than we really anticipated. I think that's one thing as you guys start to plan your own reopenings is you have to be extremely flexible. I'll give you an example. Yesterday in Ohio, we had our largest numbers ever. So I had originally hoped to get everybody back early November, which now kind of pushes that back a little bit. But you just have to kind of be flexible and kind of figure out what's going on in your community, and everybody seems to be okay with that. So our last phase is actually to try to get us back into the classroom. We will have probably reduced days of operation. No matter what, we will keep our virtual classroom open. And most likely we will have our 2 days on our east side, 2 days on our west side to be able to slowly bring people back in. But we will be completely scheduling everybody, which is drastically different than the way we are operated for 23 years. Our program is extremely flexible. We always have that open door policy, stop by anytime, we're here 12 hours a day. You know, we have these official class times, but you know, we're kind of very flexible. So with all of this, unfortunately, we will not be able to continue to operate that way for a little while. So we've had to make some changes that I'm sure all of you will continue to make. So everybody will have to make an appointment. The staff has been great. They set up the appointments with the students. People follow up with them as reminder calls. We've created appointment cards also to kind of really make sure that that happens. And really stressing to be on time, which is a challenge for many of our students. A variety of other barriers, so lots of other things going on. But if they're not on time, then we're preventing somebody else from coming in and taking their spots. Really stressing to our students that if something comes up, to make sure that they let us know so that we can try to open up additional space for a potential another student. We've also kind of really limited what people are allowed to bring in the classroom. So no large bags, grocery things, anything other people. We always provided coffee, tea. Tutors were always great about bringing light snacks. So we've had to kind of eliminate that so everybody is wearing their mask at all times. And really our intake process is really has shifted. So students would literally just walk into our classroom, they'd pick up their student folder, the site coordinator would match that. So it's a whole process for them to actually even walk into our building, from the signing in, the taking the temperature, and asking a couple questions in regards to their current health and if they've been exposed to anybody. We are washing everything down continuously. As soon as one person leaves, we're constantly cleaning our classroom to make sure that everyone feels safe and is confident about how we're moving forward with that. We've also created some, that's fine. So we've also created some manuals for the staff, which I'm happy to share with everyone. I'll email them to Todd about just some basic things that we kind of shared with the staff as reminders as we begin to open up. And then with the help of one of our board members and a vendor, we were able to get all the lovely PPE for the staff so that everybody has branded face masks and lanyards and hand sanitizers as we move forward in all of this.
Todd, we did 28 minutes, right?
No, that was great, and we have some questions. And just who would have ever thought that having a pandemic is a great opportunity to produce a variety of branded merchandise? It's crazy. We did have a lot of questions about your approach to digitizing materials. You talked about digitizing materials and how you deal with issues of copyright. And I'm going to let you talk about kind of what you did, but I also have something to say towards that, with Pro Literacy also having a publishing division of New Readers Press. So you go ahead and kind of talk about like what materials you used and how you approached it, and then I'll say something.
Right. So we use actually a variety of different materials because we feel like a lot of the things that are out there don't necessarily give students either enough information or enough practice. So we break all of our materials down into these to packets that focus on different skills at different levels. We scanned all of them, and they have to, like, they're not widely available. You have to have access to that drive, and it kind of works the way that it does at my university, because we have the same issues with copyright. If I want to make articles available to my students, they have to be in a pass protected environment, and our materials are in a pass protected environment. They're not accessible to anyone except our staff and our tutors. And so that's kind of how we address that issue. We kind of took a lesson from the way that the universities handle it.
Okay.
As you guys really think about our curriculum, we don't operate out of a single book, which I think a lot of programs may. So as Carmen shared, we may take, a lesson on fraction from here, a lesson on quadratic equations out of this concept, just so we're really addressing what the students need and how they learn best.
Right, and staff we've also had, moments where we've all been like, I hate this, can we come up with something of our own? And so we also have some things that we've created that's a part of that.
Okay, great. And I was going to say, this question came up in, not surprising, as everything has moved to virtual instruction. So this question came up in our last webinar as well. And I was just going to say, so kind of the rule of thumb that I always tell people just to kind of use as a guide. If you are copying or digitizing something to make it easier to use, you're generally going to be okay in terms of being in line with the spirit of the copyright law. If you are copying or digitizing something so that you don't have to buy something, then you're not. And so a good example of that would be, from our materials, if we were using Laubach Way to Reading and trying to use that in a Zoom classroom, if I'm the teacher and I scan and digitize pages from the Laubach Way to Reading student book that I have, so that it's easier for me to put those up on the screen in my Zoom meeting and have students look at them, then that's okay. I have the book. We have a book for me. We've purchased it. And I'm just copying it to make it easier to share instead of holding a book up in front of my computer camera. If I take those digitized copies and I email them to all of my students, instead of sending them a book through the mail, then that's a violation of copyright, the copyright law, because I'm taking something and sending it to other people without, instead of purchasing the book. So I would want to make sure that I had the book for all of my students, and then I sent that book to them through the mail. So they have the book there with them, using the book, and then the only thing I've digitized is what I'm showing them, really to make it easier to display. And it would be the same thing as putting it, laying it down on a document scanner or a document projector in a classroom or something like that. So that's just kind of, that's not a kind of a legal definition, but it's a good kind of rule of thumb, and a good way of looking at dealing with the copyright laws. I hope that's kind of helpful to everybody. Let's see, we did have a lot of questions about your laptops. So we did have questions around how did you approach in getting laptops or donated laptops to your students, and were they regular laptops? Did you use adaptive technology like touch screens or tablets or anything like that? So can you just kind of talk about that whole process?
Sure. I knew that we needed to get technology to our students just because the majority of them didn't have access to them, since our libraries and any place that they may have gone to access a computer was no longer available. I reached out to our vendors, donors, community partners, and it took at least a month or so, just making phone calls and seeing if anybody had computers that they were willing to donate. The computers were actually pretty nice that we've gotten. So they are probably about 3 years old. Everything is Windows 10 on it. Our IT company was kind enough to donate their time. So they went through them again just to make sure they were completely wiped out. There was no information on them, and then really set them up so that they were student user friendly. So landing right, opening up right to our website, linking right to our virtual classroom, to make it as easy as possible for the students to use. We did pickup days at both of our locations. Very scheduled also. People had certain times to come in and pick them up. We had dropped some of them off at students' homes just to make sure if they had transportation issues, so they had access to that. And then we've done some how-to classes, I guess is the easiest way to say that. Connecting your computer, how to log on again, connecting to Wi-Fi, things like that.
Okay, great. And I think Patty, have you got another question from folks?
Well, just to go in order and the order in which they typed the questions following up from the laptops, they wanted to know how you are reaching those potential students without going out into the community.
Well, again, so we communicate to our students chiefly through email, phone calls, and text messages. And we do that on a regular basis. So they know when we have something new coming up, what they know when we have different program offerings. And again, we had people come to our site. I can go back to that slide, but we had them come to our physical location, and everything was done. I mean, we used our barriers to make sure that that was done safely. When we did have students when we did have a couple of staff, actually I was the only staff member going out in the community and dropping them off to people who just were really eager to participate in the course, but just didn't have transportation to come pick up a desktop computer and take it back on public transportation. And in each of those instances, I just made sure that the students had masks before I got there. I had masks and sanitizer in my car. They're really, what we did is I would sit the unit on the hood of my car and just show like the box that they were in on the hood of my car, and just show them you put the boy parts with the girl parts, just like you do with biology. And most of them were able to do that. If they had any issues, they could always call and we could walk them through things. We did how-to videos about every type of technology that we were also able to send to students. So we were very, very careful about maintaining, because this was in March when we knew even less. And, we were all really doing everything we could to limit our exposure as much as possible. So we were just really, really careful. We were not going into students' homes. The closest was being at someone's doorway with a box if they had any physical difficulties or anything.
But even for recruitment stuff, so we have great communications with who we currently have. We've spent a lot of effort really kind of boosting up all our social media. We were very fortunate to have an SEO intern with us this summer. really trying to boost that up to really just get the word out that we have this unique virtual classroom opportunity so that one-to-one tutoring is still going on. Oddly, we've recruited students from a variety of different states.
And tutors.
And tutors, yes.
Yeah. Got tutored from Minnesota yesterday.
Oh, that's interesting. Now, just a follow-up question. When you're talking about emailing and texting people, are you just doing that like you would send a regular text to your friends, or are you using any kind of texting software like WhatsApp as a communication tool? Or I know some programs have used like Remind or things like that that make it a little bit easier to send out mass text or mass communications.
Mm-hmm.
We actually use Slick Text. We were fortunate a couple years ago, maybe 3 years ago, when you guys were doing a pilot project to be one of the organizations selected to do that. And we've continued to use that.
Okay, great, great. So another question, how long is each Zoom tutorial session? So if you have experimented with this, like what do you find to be an ideal length?
I think it varies by the student and tutor. It really depends on their own endurance at this point. I mean, I feel like my attention span for Zoom is getting shorter by the day. But we're still offering, just with our regular class sessions, we're 2 hours. So from 9 to 11, 1 to 3, and 6 to 8. And even with our regular class sessions, sometimes there will be students who would come in at 9 and stay until 4. So it really is very flexible. Often what will happen is a student will start with a tutor on reading and do reading for an hour and then stay on and do math for an hour. So it really just depends on the individual students and tutors.
One thing that I think is also unique that we've done with the Zoom, it's an open link, so it's not a stop or start thing. So the staff is there during those class sessions, that's how we refer to them. But the students and the tutors have that option to connect if there was outside of that time too.
Okay, thank you. Patty, you want the next one?
Yes, and here's the next question now. In order to, now that we saw your barriers and your sanitizers, there's a question on how much did it cost to actually purchase all of that? The barriers, the sanitizing equipment, or in other words, how did you fund the COVID proofing in your building?
I spent a lot more money than I anticipated, just to really make sure we're safe. So I'll just give you a quick little financial background. So SEEDS does not have any secured funding. So we are not funded through the State of Ohio Aspire program. So we have to raise our own funds every single year. So we are a little bit under $2 million for our operating budget. I spent probably close to $20,000 to kind of do all our prep work. Our community really had some great emergency funding that was available. The foundation community all came together, as well as a lot of the corporate foundations, and created an emergency fund. Initially focused on some basic needs stuff, but then kind of expanded that. So we were very fortunate to receive some of that. And a couple of our long-time funders also stepped up to make sure that we were able to get the supplies and everything that we needed.
Great. I actually have another question. It was kind of like a follow-up from the donated laptops and computers. Are these students expected to return them, and how did some of them get the internet access?
Oh, that's a good question. We actually, initially we reached out to see what resources there were in the community. So one of the resources that's here in Cleveland is called People PC, and they provide low-cost computers. And so our initial effort was to try to find funding to get computers so that we could help students afford them. That also came with hotspots and things like that. And I think because the response with all of the K-12 kids also looking for technology, they just never got back to us. And fortunately, Bonnie's efforts paid off. We researched what options were available. A lot of the telecommunications companies like AT&T and Spectrum and that in this area provided services. So we really researched Spectrum to make sure that students wouldn't be in trouble after so Spectrum offered 60 days of free internet. Again, I think that everybody was thinking that this would be much shorter term. And so we helped our students connect to those services, and we spent hours on the phone making sure that and actually we've spent hours on the phone since then. So if a student gets a bill, I'm calling like, so you told us that this free service, so are you telling me this free service is now $60? Should I put that on our social media? You know, that kind of thing. So we've been trying to help them access it that way, and then just trying to connect them to different sources that we're finding. It looks like the free opportunities are just about drying up now. So now we're seeing low cost services. One of the AT&T has something where they're providing 10 megabytes per second, which is not as fast as we would need for work. But if it's someone at home accessing some materials, that might not be too terrible. And it's like $10 per month. So the connectivity is something that we've been thinking about. We also, Bonnie and I are on a lot of different committees, and those are some of the concerns that we make known so that our legislators understand that that is going to be a continual need in the community as long as we're, experiencing this. So there are some efforts in the Cleveland Northeast Ohio effort to think about ways to provide free broadband to at least the inner city communities where there's great need.
And Carmen spent a lot of her time too, really making sure that those vendors really consider our students, adult learners, as students. Right. Initially, a lot of things were focused on just on the K through 12 students and really didn't look at the adult learners. So we really pushed to make sure that everybody realizes that our students need those resources too.
Which, honestly, that's another thing that I think another reason that the staff was like, we're going to continue providing service around the clock to students, because we also realized that a lot of our students were going to be helping their kids with virtual school during the day. And so we had to keep our evening classes open so that they would still have the opportunity. And it's also why we decided to do some recorded lessons, because in that way, no matter what time of day they want to focus on work, they have something that they can access from us.
Great. We have a couple of questions about kind of the opening and reopening and the different phases. So I'm gonna combine a couple of them. You mentioned, I think you said like just the other day, you had like one of the highest COVID positive testing rates that you've had all year. So we had a question, was there any, or what health and infection data did you use to inform your kind of determinations for each phase of your reopening process? So like, were there kind of triggers that you used or data that you used for when you had staff come back into the office? You started doing live assessments, those sorts of things. And then kind of the second part of that is as you're moving into the fall and really thinking about reopening classrooms in a limited capacity, have you also thought about the possibility that you'll have a spike in fall or winter and you may need to return entirely to remote instruction? Are you kind of planning for those two likelihoods, and kind of how are you dealing with that and communicating with your students and tutors about that?
So that's a Bonnie question, but can I just say that she thinks of everything.
I will be honest with bringing the staff back. It was more, I was getting very worried about everybody. So I did make some cuts as we knew COVID hit in reduction of staff, but I really just saw everybody working literally 24 hours a day. They were working every moment that they were not sleeping. So it brought everyone back really for some good mental health to try to help us find a little bit of balance in that and try to tackle as we move forward. Here in Ohio, I actually get a text almost every day in regards to what our numbers are. And they have coded every county based on numbers of infection, hospitalization, and a couple other factors. And everybody is color coded at 4 different levels. So when Cuyahoga County is where we're at, we were at level 3 for a very long time. And that's one of the main reasons I kind of kept pushing back our reassessments. So we finally went down to level 2, so our numbers started to decline, and I still let that hold for a while to make sure that those numbers didn't spike again. But we've remained at level 2 for probably 6 weeks now. I try to really look at things in time frames of probably 4 weeks at least, just because based on our touch space or our connection or interaction with each other, and that it could take potentially up to 2 weeks for that infection to spread. So those are kind of the big areas that I really look at. And yes, I do think that there could be another possible closing of everything. Ohio did completely shut down, so I did make sure that the staff is able to have a complete home office. We have our phone system has been great, we don't have a fancy phone system. We're literally able to take our phones and plug them into our routers at home and to keep everything operational. Every staff has a laptop, so they're able to access our servers. Everything we store has been on central drive, so everybody has access to those all the times. I've got some printers to make sure everybody has those at their homes, but definitely prepared in case we have to shut down again.
Okay, thank you.
Actually, I was gonna follow up with a question to see if you can speak about the clients who walk into the building. When you ask them the COVID questions, do you have different interpreters for like the people with the different languages or interpretation available to them?
Well, we're not an ESOL program. We do provide a full range of basic skills and GED prep, but most of our students, we do have some students who speak Spanish, but we do have a bilingual staff member who handles all of that. Our population, we don't really have a lot of folks who don't speak English. We have several people who are multilingual, but that's not really a challenge for us.
Great, thank you.
Then,
Questions together. Go ahead, Todd.
no, I was just going to say, so another question kind of in line with the phases. So for phase 3, when teaching live again in classrooms and limited capacities, will your teachers and students be wearing masks? And if so, do you have any concerns with, excuse me, with students being able to understand the teachers or teachers being able to understand the students?
Yeah, I don't think that that's, I mean, we've got students, we've had students coming in for reassessments for a few weeks now, and the communication hasn't really been a barrier. If you're sitting at the table with someone on the other side of the plexiglass barrier, it's just a sheet of plexiglass. So I don't think that that's going to be that much of a problem. We actually had a student here the other day who has, I mean, her communication's a little bit mumbled, but it was still very clear. I think the biggest thing is the tendency to want to take the mask off so that you can say something. It's like, you know, I think that's the thing. The biggest thing is just getting people in the habit of being okay with having the mask on. And we've actually had a community service worker who we almost dismissed because she just, every time she wanted to say something, she would just reach to take it off. And it's like, you've got to learn to do, because we have to protect everyone. We don't want any of our students or our tutors or any of our staff to get sick. We don't want to take this home to our families. So we're being very, very careful. And the one thing that I will say is I probably out of all the staff, I feel like I was probably the most nervous about all of us returning because, you know, when you're in this cocoon and you're not interacting with people and you're working from home and you're in the grocery store at 7 o'clock and out by 7:15 and you're not interacting with the public a lot, there's still a lot of that fear. And I think it was just so smart to bring the staff back and have us interacting with one another and then realize that we were actually okay because we're all trying to be responsible for one another. And we are communicating to our students that, you know, our reopening is up to you. You know, we need you to show up for your appointments. We need you to be safe. We need you to, you know, follow the guidelines that we have in place. And I think everybody's really kind of taking, I think, you know, from the students that I've interacted with, they really want us to be back open. So they are willing to do what we need to do so that they can be reopened. And it doesn't mean that we don't have to say, oh, I need you to pull your mask up over your nose. But I think that that's just part of the process. And I mean, we're educators and we are educating them about this public health issue, just like we educate them about, you know, literacy. So I think that really has been the biggest thing is people wanting to take the mask off, or people who say, oh, I can't breathe with this thing on. And I'll say, you know, doctors wear masks all day long during surgery. I think you'll be okay. If you need to have a seat or if you need to step outside and take it off for a moment, you know, you can do that. But I mean, I think this is just something that, you know, we have to be prepared for. I was watching something on TV recently and the doctors were saying, we should all just be wearing masks for the next 2 years. So it's part of our reality at this point.
We've also, in that screening process, and I think it maybe helps them realize how serious we are part of the process. So everybody gets a wristband every day. It's a different color every day, just to let everybody around them also know that they've all been screened already. We've asked, you know, the symptoms questions, the exposure questions, and they're ideally wearing the mask, but that just kind of has helped other people realize that it's just not them that we're asking, it's everybody who walks in the building.
Great. Patty, you've got another question?
Yes, I want to ask about enrollment. So how did you deal with the low enrollment you had at one point? And how were you able to reach out to new students?
So our enrollment has shifted a little bit, more in regards to, I think, the participation during class, but our orientation numbers are very close to what we were pre-COVID. So probably on average, we were doing probably a little over 60 new students every single month. We do weekly enrollment, so people didn't ever have to wait for start and stop time just because everything's individualized, we're able to do that. So we have been doing our orientations remotely, obviously drastically condensed. In past, it was a 2-day process, probably close to 6 hours. It's very basic right now, a lot of kind of pre-work where they can do all the paperwork ahead of time, an hour orientation, and then kind of a lot of follow-up with that. And students are really new potential students who had no connection with us are really just finding us through our partners, general Google searches. We've just really made sure that our website is constantly updated. We have a great communications director who makes sure that is always happening. We're very active on social media, making sure something is posted on a daily basis, and making sure that those communications are really moving forward and happening on time every day.
Great. I'm going to just kind of remind people that we're coming up on the top of the hour. So I'm going to take just a little bit of a break to thank everyone for attending. And Bonnie and Carmen, thank you again for presenting. As I said in the beginning, you guys have been gracious enough to agree to stick around and answer everybody's questions. So we are going to cut the questions off at the top of the hour. If you have something that you really want to have answered, I would encourage you to type it in now. You're welcome to stick around and listen past the top of the hour to hear the answers if you don't want to wait for the recording. But again, kind of just to remind everybody, everything is being recorded. We will send out a follow-up email on Monday that'll have the recording and the slides and all of that. I know that people were having difficulty hearing some things at the beginning, so we will try to get some closed captioning with that recording to kind of help with that. So thank you all, and we're going to get back to the questions now. So I have one, and I want you to respond to this question, but then I also have something to say about this as well. And this is from Kay. She says, my students are totally computer illiterate. They don't have Wi-Fi. They would struggle to sign up, log into any kind of Zoom class. How did you get students over that initial hump in terms of connecting them with the technology and getting them able to set up? And I think, Carmen, I think you talked about that a little bit when you were talking about delivering the computers to students. But can you go into a little bit more detail about how you supported that?
Sure. Well, so to be honest, we had some students who were like, I'm not willing to try the virtual. We have had some students who just flat out refuse. Call me, check on me, email me, text me. That's all great, but I'm not logging into a virtual classroom. So that was, I mean, we do have some students who just are just not willing to do that. For the students who were willing, I think a lot of it, the sending them the videos, YouTube videos via text, they do know how to use their phones for texting. They do know how to open YouTube links and they're used to that. So using those videos as a way to show how to do the process is really helpful. And then honestly, Zoom is so much easier than the GoToMeeting that we were using, that we just send the students the one link, they click on that link and it brings them right into the session. So if texting is a possibility, that might be one way to get them to do that. But the other thing that we did is when we have students who are really, really struggling, even students who are saying, you know, I really want to attend your program. I know that it's tele-tutoring and video tutoring, but can I just come in for orientation? We have been doing a few socially distant orientation. So we may have a student in the room while I'm doing the presentation, but I'm masked, they're masked, and they're in the back on like one end of the room and I'm on the other end of the room with a laptop. So they're able to see, I can project what I'm presenting or put a laptop in front of them so they can see the presentation. So we just made a lot of adaptations in that regard, but then we've also had some students come in and again, we're able to, in both of our classrooms, we're able to project what we're showing on our screen so that we can show a student, walk them through a process while they're working on one of our computers and they can see what's happening on our screen. So we're still able to maintain that social distance. And last, I would say that you know, a couple of times we have one staff member who has been able to walk students through how to download. I'll have to get the name of it. But there's a program that you can load where you're able to gain remote access, and we have had one staff member who has helped a couple of students, you know, where that way, so they can turn on their computer and he can show them how to navigate from where he is on their computer screen. So we've done that for a couple of students as well.
And I really think it's a lot of our relationships that our site coordinators or teachers have with the students, really being able to encourage them that this is something that they can do. We have tried, digital literacy has been a struggle for us since the switch over with the GED in 2014. We've tried everything, but I think it's just been those site coordinators really encouraging the students that at least let's try with the phone first, just even with that conversation with a tutor, and then trying to take that, pushing them to the next step so that they can take advantage of what we're offering.
Great. And then I'll just kind of follow up with that, Kay. So our webinar last week, Michael Evans from Kalamazoo Literacy Council did a really good presentation on that. And some of the things that he talked about was kind of making sure, if you can, to kind of have all the same technology. So as he said, you have all the same problems, to set up all of those computers the same way. And then the biggest support, he said, was having visual guides for every single step of the process. And I think you guys just talked about like using a video to show them how to do it. So his folks, when they received the computer, they received a visual guide that went along with it, and it had a picture of the computer, where to push the power button, how to plug it in, and, you know, a picture of the screen, and it said click here, and they were able to get things going. And then he mentioned something, a piece of software very similar to what you were talking about. It was called Team Viewer, which allowed someone from the program to gain access to the and manipulate the screen of the student's computer. And I'll post a link to that in the chat room. So I hope that's helpful.
I would also say that I mean, Bonnie mentioned the relationship with the tutors, but I think the tutors are some of the ones, you know, so for even our students who said, well, I'll do the tele-tutoring, but I'm not ready to do the video tutoring. We had a couple of events that they really wanted to participate. Like we had a book club, and our book club read Michelle Obama's book. And so we were doing a viewing of her Netflix special. And so we did a GoToMeeting streaming of her Netflix special so that students could attend and be with the tutors. And so I think a lot of our tutors were able to convince students to try the video, even though it wasn't what they initially wanted to do. And we had a student here this morning who came in for reassessment, and he wouldn't reassess until he'd had his time with his video tutor. And he brought in this laptop, but he's brought this laptop in for probably the entire 2 years he's been here. And he's never been really willing to do the digital literacy. But let me tell you, this morning he got into his video lesson. He accidentally opened a YouTube video in the middle of the session. I mean, it just is really learning how, like, their willingness to engage with the technology has shifted a lot because of the fact that they want to stay in contact with their tutors that they've been working with.
Great.
That's great. And also, I wanted to follow up with a couple of questions now that we're talking about tutors. The question is, have you made any adjustments in working or training your tutors? And since you also mentioned that some of them were older volunteers, have they been able to return to meet face-to-face, or are they not? Or are they concerned?
So that was probably our biggest, in the very beginning, that was our biggest concern because of course, I mean, like everyone else, we were hearing that seniors were more at risk. And again, over 50% of our tutors are over 60. A lot of them are physicians, retired physicians, and they were telling us, see you guys in this vaccination, I'm out of here. And so we knew that that was gonna happen. Honestly, the response from our tutors has been really great because even the ones who didn't want to continue tutoring were willing to do things like write encouragement cards. We sent out 400 cards to 400 different students at the beginning of the pandemic to just let them know that we're still thinking about them and we hope that them and their families are okay. We had a lot of tutors agree to do the telephone tutoring, and then we continually, you know, we normally do, again, a full day, 6-hour face-to-face orientation. We modified that to now a 1-hour Zoom orientation where we give them really just kind of the basics of what our program was before, how we've adjusted, how we plan to go back so that they're familiar with that. I'm actually not as concerned about the fact that we've abbreviated that because we have a program of continuing professional development for our tutors and our staff. So that's, but we've also reached out to our university partners. We've been recruiting tutors who are a little bit younger, a lot more comfortable with technology, and because they're also looking for opportunities to contribute because of the pandemic, and they're, you know, on their campuses, they're closed in their dorm rooms too, and they want to reach out too. We've had an overwhelming number of people say, well, I can't do all the things that I used to be able to do, so now I have time to volunteer. Where do I sign up? Because I hear that you're doing this online thing where I can still help someone else, but maintain that social distance and my own personal safety. So I don't think, I think that, we definitely have some tutors that we haven't brought tutors back yet. They won't come back until we're in phase 3. But we do have some tutors that we know we're not expecting to have back because they have underlying health concerns. But we've asked some of our tutors as well, like, have you, and that's one of the things that we plan to do is to reach out to our tutors to ask how often, you know, how many of them are willing to come back on site. We're going to continue to provide the virtual, so if they're not willing to do that, that hopefully they'll transition to being a virtual tutor. And also, you know, we're keeping in mind that everyone has a different risk threshold, and we are making sure they're aware of everything that we're doing to protect them and keep them safe. And, you know, we'll see how it goes because we've got people coming in now for new tutor training who are like, well, when can I come on site? And we're like, well, you know, are you watching the numbers in Ohio? We're watching the numbers in Ohio. And they're ready to jump back into it. And then we're getting some folks who are like, well, you know, look, this virtual thing is working for me. And if you're going to continue a virtual classroom, I'd like to continue that way. I don't know. We're trying to be realistic and see the things that are really before us, but we're also just optimistic about looking for the opportunities that this is all presenting.
Pre-COVID, we used volunteers for a variety of different stuff. So we've also been able to present some of those opportunities for our tutors if they're not comfortable with that technology. We have some volunteers right now who are literally just running random errands for us, you know, pick up of our supplies or books or anything that we may have, as well as people helping us kind of with that screening process. But we've been very fortunate with our volunteers. They're always there to help us. We were able to do our graduation virtually. To participate. We actually had a volunteer photographer kind of help us out who did post pictures for all our grads so that they would still be able to have those graduation pictures since we were not in person at that time. So anybody who's kind of willing to share their talent with us, we are normally able to put them to good work.
Great. Great. I think that's an important thing to remember, that there are a lot of ways to engage volunteers. I have a couple of instructional questions to ask. So one is, When you're delivering services remotely by telephone, did you discover any good practices that you'd like to share with us? So things that particularly worked really well, either strategies or, specific types of content that you found was more effective or more easily delivered than others?
Well, we just actually had a tutor student pair featured on the news recently talking about their experiences because they worked together pre-COVID, and so after COVID they continued that, and they got to the point where they realized that math is not a telephone topic. It's not working for me when I can't see what you're doing in math, or when I can't show you what I'm looking at or what I'm working on or what I've written. So I do think that that has been a lesson learned. Now, there are some students who don't really have a problem with that. Obviously, students who are a little bit more confident, a little bit stronger in the math, didn't have difficulty with it. But I think, again, it just depends on the student and the tutor pair at that time. But as far as the language arts lessons, I mean, even some of our beginning readers have been doing telephone tutoring, where we've prepared binders where the tutor has the binder and the student has the binder, and these are all materials that we've created on our own. So no copyright issues there. The tutors have the materials, and the student has the materials in a binder, and the pages are numbered, so they can just say, okay, we're going to do column 1 on page 2, or the column that begins with ab, and then they've kind of been working through that. So I think that I think one of the things too is that early on we use the telephone tutors as a way to continue reaching out to students who are reluctant to try the video tutoring, but we really try to transition as many of them as possible over to video tutoring if they have the capacity. And pretty much everyone has. We still have a few folks who are just a little bit reluctant to do the video.
We did learn a hard lesson. So we did find out, so we used freeconferenceline.com, and we did learn that there are several cell phone vendors that do charge for that service. So that was a hard lesson for our students to learn as well as us, but we did come up with a workaround with that. So we have students will call into our office to a local number, and then we are able to transfer them into any conference line so that they're not being charged to use their phones.
Right, and then we did, I didn't mention that, but we used free conference call initially for our telephone tutoring because we didn't want to, so many of our students are so concerned about privacy. So we didn't want to give out student numbers, and we also didn't want to give out tutor numbers. So we had them use the free conference call service, and then the tutors and students would just call and wait. Tutor would log in during their session, and when a student called in, they could call into that line, or once we found out that students were being told they were going to be charged, they would just call our central office and we would transfer them to the line, and then there was no charge. Bonnie also figured out a way that the students could call me to the conference line, and the conference line would call them back, and they could also avoid being charged that way. So a couple of students did that because it was just easier for them to do that. Now we're able to conference students into the Zoom. If they want to participate by phone, they just call our office, and then we can transfer them into the Zoom call. And they show up on screen just like, some of you are probably on your phones right now, so they still show up on screen. They're still able to hear. Most of them have smartphones, so they're able to see what's on the screen as well.
Okay, excellent. And then kind of another question about instruction is, could you talk a little bit more about the recorded lessons? Is this a staff person or a volunteer tutor who's recording the lesson? And what type of lessons have you recorded? What type of lessons have you not recorded? How do you distribute those recordings? Just a little bit about that.
Sure. So we asked our tutors if they would be willing to do the live lessons. Our staff was fairly busy at the beginning of this with the reduction in staff, and then also with just, really trying to get things going. We were working around the clock. And so we asked our tutors if they would be willing to prepare some lessons. Many of our tutors retired and they were like, sure. And then we have some tutors who are like, oh, well, I teach K-12. Here are 15 PowerPoint slides on this math topic if you'd like to use them. Most of them created their own PowerPoints and did their own. So that was the tutors. They all agreed to be recorded. The lessons range anywhere from 20 minutes to 40 minutes. One lesson we did learn from that is that students have, they've just been conditioned to watch these very short videos. So we were noticing that they were watching maybe 5 minutes and then disconnecting. And then, so they're housed on our website as YouTube videos because, again, we wanted to have them in a format that students were familiar with. Our communications director makes us put everything on the website, like everybody's answer should be, it's on the website. So she's been very good about making sure that those were updated. Our schedules, we were scheduling tutors in the beginning, and Zoom removed the need for that, so we're not doing that anymore. It makes it a lot easier. So they can just access all of those links on our website under recorded lessons.
Okay, great. We've got a few more. So one, you talked about, like, you guys have a great phone system. I'm assuming it's the voice over internet protocol type phone, because I think you mentioned plugging it into your routers at home.
Mhm.
Can you talk about, like, just tell us what phone system you use?
Sure. So if any of the staff would say, I'm definitely someone who's very frugal with our budget because we work so hard to raise the money. So it's not, we use Polycom phones. We use a company called Lingo. And it's fairly inexpensive. So it's $20 a month per line for a phone. So it's cheaper than trying to pay for someone's cell phone. And it just creates a system where you have auto attendance. So you have someone, if the reception's not available or on other calls, that phone is being constantly answered. And it's just kind of manipulating the system a little bit to go to different extensions for different information. But it was great that everybody could take that phone to their house and we could still stay all connected with the students and the tutors without sharing our personal cell phone numbers with everybody.
Yeah, that's fantastic. Thank you. Can you describe, you've talked a lot about your student assessment process. Can you talk a little bit about that? Excuse me, talk about that a little bit more so people can kind of get an idea of what that looks like and what assessments you use?
Sure. So we explored tape online, but obviously with the kinds of access issues that we described our students having, we didn't think that would really be something viable. And also, I don't know, it just seemed like it would be not the kind thing to do in the middle of a pandemic. So our program staff, our site coordinators, have developed a math assessment tool that they use after orientation, which it's not a standardized assessment, but it gives students a nice sample of math topics, and it just allows us to see what math topics they've mastered and which math topics they haven't mastered. What we did is we took that assessment and we put it into a Google form. So students can look on can access the link from our website. We send it to them and they look at that Google form and the problems show up on the screen and they just type in what they think their answer is. We ask them not to use calculators, but they can use scrap paper if they'd like, and we use the honor system with that. And we really stress to them, this isn't a pass-fail exam. It's just to give us information on what materials you're going to pick up when you come in, or what materials you're going to use in your class. For the reading and language, we use an oral reading fluency assessment, and then we have a phonics assessment that we created ourselves to just kind of identify what needs students have in terms of their learning. And so it's just kind of a way to help us figure out where to start them in the program in the absence of the tape testing. At this point now, since we're in phase 2, we're actually starting to, as a part of our orientation, just scheduling students to start coming in for their actual appointments. So now during orientation, part of the conversation is, when can you come on site for an orientation? We have an online schedule in 4-hour blocks. So if a student wants to come in and torture themselves with a complete tape, they can do that. And if they want to break it down into 2-hour sections, they can do that as well. And I mean, some days we're here until 8 p.m. with them testing 2 days a week, and the other 2 days we're here until 6. And our schedule just kind of tries to accommodate the fact that we're also still running our virtual classes with this, you know, small but mighty staff. So that's, those are the initial assessments that we use, and then we are hoping to get that tape data again as well.
Great, great. And then we have our last question from Kathy, and it kind of goes back to the idea of the teachers and students, everybody wearing masks. So her question is specifically around phonics, where it's a little more important for the student to be able to see, you know, the mouth of the tutor and how letters are, how sounds are being formed.
Mm-hmm.
So have you given thought about, like, if you have like really low level students that are working on phonics, how to address that issue at all?
Yes. So, well, for one thing, they're doing the video tutoring right now. So you can see the student's mouth, and on the camera, if they're on camera, you can see it. But also, even when we do even before COVID, when we did our training with Tutors for Phonics, we use a lot of physical cues. So where are your teeth in relationship to your upper lip or your bottom lip when you're making that sound? Where's your tongue in relation to the roof of your mouth and your teeth when you're making that sound? So there's that. And then again, we do have the barrier. So if someone did feel like they wanted to like re-emphasize, they can emphasize on the other side of that barrier. I've worked with a student who has come on site, and anytime that I feel like he's not really following what I'm doing, I just move across the room for him and just move my mask for a second and show him what I want him to do. And then I put my mask back, and then we're still 6 feet away from each other. But for the most part, they're still doing video.
Okay, great. I think that's an excellent answer. And that wraps up all of our questions. Thank you again for agreeing to stick around and make sure everybody's questions were answered. We really appreciate everything you had to offer, and I'll thank everyone again for